Erectile dysfunction is a condition that affects men just not being able to get an erection and maintain it for satisfactory sexual intercourse for the patient or their partner. It's more common than people believe it is, and it's more common than we'd like to see. And so the statistics are very different in variable demographics, but it can affect any age, and it affects a lot of men, unfortunately. Erectile dysfunction is caused by a multitude of disease processes. Some of it is organic, like diabetes and hypertension and vascular disease, among other things. Also, a lot of the medications that men take for various other diseases can also affect their erectile function. Trauma can affect erectile function as well, amongst other things, but those are the most common conditions. Well, erectile dysfunction is a diagnosis that is really subjective, perceived by the patient. If the patient says he's not having satisfactory erection for satisfactory sexual intercourse, then that is a diagnosis of erectile dysfunction. Erectile dysfunction can be prevented in some situations. I think a healthy lifestyle overall decreases the chances of you getting an erectile dysfunction. Some of the main things include smoking and an unhealthy diet and a sedentary lifestyle. Erectile dysfunction is a sensitive subject. It's very important for you to talk to a specialist who is well-versed in diagnosing and treating this condition, so you get the most accurate information and the best information that suits your situation. And so I think talking to a specialist about this is the best way to go about taking care of it. There are a lot of treatment options available for erectile dysfunction. We start with medication for most patients, and there are other modalities like the vacuum erection device. There are also injections that can be injected and cause erections and help with erectile dysfunction. In addition to that, we also have prosthetics, which is the penile implant, which can help a lot of patients with erectile dysfunction. Every patient's situation is different. I like to sit with my patient and discuss the sensitive issues that are affecting his quality of life in regards to erectile dysfunction and find out the best option for him and his partner. Some patients prefer medications, others prefer injections, and for a lot of patients, the penile prosthetic is the best answer. The satisfaction rate for the different treatments for erectile dysfunction is variable among patients. Usually we hear between 40 to 75% for the medications. For the injections, it's about between 60 and 80%. For the penile prosthetics, it can be in the high 90s. Unfortunately, if you don't have erections on a regular basis, you start to lose some of the tissue in the penis, and you start to get what we call corporeal atrophy, or in other words, shortening of the penis.